Did you know that millions of people are living with hepatitis without even knowing it? The scary part, by the time symptoms appear, the liver already is damaged. So today is World Hepatitis Day, and I will explain everything you need to know about hepatitis, its types, how it spreads, symptoms, prevention, and why early testing lives. So I am Dr. Ria, and let's make liver health a priority. So what is hepatitis? Hepatitis simply means inflammation of the liver. The liver performs hundreds of essential functions, including removing toxins, producing proteins, helps in digestion, and storing energy. When the liver becomes inflamed, these functions are affected. So, viral hepatitis is caused by a heterogeneous group of viruses that are hepatotrophic. So, they cause acute inflammation of the liver, producing identical histopathologic lesions. So, these clinical illness they will cause fever, nausea, vomiting, and jaundice. So, there are five major viruses. First is hepatitis A, which spreads to contaminated food and water, usually causes acute illness, does not become chronic, and preventable with vaccination. Next comes hepatitis B, which spreads through infected blood, unprotected sexual contact, and from mother to baby during childbirth. It can become chronic and it may lead to liver cirrhosis and liver cancer. A safe and effective vaccine is available. The third is hepatitis C, which mainly spreads through infected blood, especially unsafe injections or needle sharing. The symptoms are not effective for many years, so many people can now be cured with modern antiviral medicines. Next comes hepatitis D, which occurs only in people who already have hepatitis B, and it makes liver more severe. Preventing hepatitis B can also help in preventing hepatitis E. The fifth hepatitis E. So it spreads through contaminated water and it usually causes acute hepatitis. It can be especially dangerous during pregnancy. So next comes the symptoms of hepatitis. So many people infected have no symptoms at all, especially in the early stages. When symptoms occur, they may include fever, fatigue, loss of appetite, nausea and vomiting, pain in the upper right side of the abdomen, dark urine, pale stools, yellowing of the eyes and skin known as jaundice. So never ignore persistent jaundice or unexplained fatigue. So now I will explain the important laboratory tests which are used for hepatitis A, B, C and E. So the first step is diagnosis viral hepatitis in serological testing, which detects viral antigens or antibodies in the blood. So for hepatitis A, two antibodies are commonly tested, that is anti-HAV IgM, which indicates an recent or acute infection, anti-HAV IgG indicates past infection or immunity either from previous infection or vaccination. Next, for hepatitis B, there are several important markers like HBsAg, anti-HBs, anti-HBc, HBeAg, and anti-HBc, IgG, and IgM. So, understanding these markers together helps determine the stage of infection. Next, for hepatitis C, anti-HCV antibodies indicate exposure to the virus, but they do not confirm an active infection. To confirm active infection, we need to perform HCV RNA PCR. Then for hepatitis E, anti-HEV IgM indicates acute infection and anti-HEV IgG indicates past infections. So PCR here is the most sensitive method for detecting viral genetic material. For hepatitis B, HBV DNA PCR measures the viral load and helps monitor treatment response. For hepatitis C, HCV RNA PCR confirms active infection and is also used to access response to antiviral therapy. PCR is especially useful when serological results are inconclusive or when treatment decisions need to be made. Other lab for laboratory diagnosis does not stop only till identifying the virus. We also need to assess how much damage has occurred to the liver. This is done using the liver function test. So the important parameters which we can measure are the ALT, the AST, which increase when there is liver injury, bilirubin, which is elevated in jaundice, ALP, and GGT, which increases in cholestatic liver disease. Albumin and prothrombin time or INR can also be used to assess the liver's ability. Then other supportive tests which can be done are ultrasonography of the abdomen, liver fibrosis assessment using a fibroscan, a complete blood count which shows thrombocytopenia, and which can occur in advanced chronic liver disease due to portal hypertension. In selected patients, especially when the diagnosis remains uncertain or for staging certain liver diseases, we can perform a liver biopsy, which can also be considered. Now that we know what hepatitis is, the most important question is, can hepatitis be prevented? The answer is yes. Many cases of viral hepatitis can be prevented by following simple but effective measures.
The first and most effective step is vaccination. Safe and highly effective vaccines are available for hepatitis A and B. Adults who are not vaccinated, especially healthcare workers and high risk individuals, should also be vaccinated. Next comes maintain good personal hygiene. Wash your hands thoroughly with soap and water before eating, after using the toilet, before preparing food. Always drink clean, boiled, or purified water. Eat freshly cooked food and avoid raw or undercooked seafood, food from unhygienic sources, contaminated street food. This is especially important during outbreaks of hepatitis A and E. Avoid unsafe injections. Ensure that only sterile single use disposable needles and syringes are used. Never reuse needles or syringes. Ensure safe blood transfusions. Practice safe sex practices. In healthcare settings, all standard precautions should be followed and safe injection practices should also be followed. Avoid alcohol and protect your liver. Always get tested earlier if you are at risk. Last but not the least, finally educate your family and friends about hepatitis. Encourage vaccination, safe practices, and regular screening. Remember, prevention starts with awareness.
The good news is that many forms of hepatitis are treatable and hepatitis C is curable if early diagnosis and treatment is done. So let's understand the treatment in brief. Hepatitis A and E usually do not require any antiviral medicines. Treatment is mainly supportive and adequate rest, plenty of fluids, a balanced diet, and regular monitoring of the liver functions. Hepatitis B requires antiviral medications such as tenofovir or entecavir to suppress the virus and prevent cirrhosis and liver cancer. The best news is hepatitis C is also curable. With modern direct acting antiviral medicines taken for 8 to 12 weeks, more than 95% of the patients can be cured. As we observe World Hepatitis Day, remember that hepatitis is one of the few major infectious disease that is preventable, treatable, and for sometimes even curable. The biggest danger is that many people don't know they are infected until serious liver damage has already occurred. That's why early testing and timely treatment can save lives. If you or someone you know is at risk, don't wait. Get tested, get vaccinated where available, and encourage others to do the same. Together, we can reduce the burden of hepatitis and protect our communities. Protect your liver, get tested, get vaccinated, and save lives.
If you found this video helpful, please like, share, and subscribe. Thank you for watching.